morning, good afternoon, good evening, depending on where you are. My name is Patrick Aparai. I lead People and Policy Unit in Supply Chain Strengthening Center, UNICEF Supply Division, Copenhagen. Today, we are going to talk about the role of leadership and governance in immunization supply chain coordination in countries. We know all that the national logistics working groups are really very critical in coordinating all the supply chain of vaccines and the other accessories, the other supplies for vaccines. And we'll talk about some experience we got during COVID-19 and see how ready they are in preparing an eventual vaccine of COVID. So my slides have five sections, but also I'll add a discussion with people from the country, like 2 countries that we selected, people who are involved in national logistics working groups or the equivalent. We selected Rwanda and Cameroon. So we are going to start by a quick introduction of what is leadership and governance, what does it mean in supply chain. We'll talk about the platforms that are offered by the national logistics working groups as a tool to coordinate at country level or the immunization supply chain. We'll discuss about how COVID-19 has disrupted this coordination role, but how they have also been adapting to the new realities, and then share some experience from countries. And then at the end, as I said, we'll just have a quick panel discussions concluded by a question and answer. So you are welcome to type your questions as I advance, so that at the end, you'll be able to share your thoughts and ask if you have any question for clarification. As we all know, the governance and leadership, it's really one of the pillars of health systems as it's been defined by the World Health Organization. It's really the aspect of having a strategic orientation of any work that we are doing, strategic policy frameworks, making sure that guidelines exist, making sure that the structures also are there to play this function, to really provide this oversight and try also to mobilize any partnership and managing the resources. As you've seen, middle governance and leadership, sometimes we prefer governance, but we also add leadership because everyone should be a leader in supply chain. If we need something transformational, visionary, something really to be more innovative and resilient, as we said. So this governance and leadership function is where we are going to really more expanding our partnerships, because we are not going to work alone. We'll be working with individuals, with organizations. How do we make sure that this governance is helping us to expand the partnerships at country level? How do we engage the community we serve? How do we manage resources, whether supplies or sometimes human resources, but also finance, but yeah, beyond maybe these national working groups. So in general, the governance gave us how to manage these resources, and of course, the innovation. Strong governance in health system would guide us really to, as leaders, to have a clear vision and the ability to motivate and mobilize other health system stakeholders. So as you think, really, it's really critical that we have a clear governance structure, and we have people that are really visionary that can help us to push this agenda. Because first of all and foremost, supply chain is about people in organizations. National working groups have been really very instrumental to, the national working groups have been very instrumental to guide all this work. Sorry for this. And has been always very critical to really coordinate immunization supply chain, whether at country level or subnational level. It's where we do have decision making, we ask accountability. In different countries, they do have these groups or the equivalent. These are really leadership groups, as I said, and the main aim is really coordination among partners, coordination among all the key stakeholders, so that the national immunization supply chain are well coordinated and are well implemented. We are able to set priorities, and we are already ready to correct anything that can really impact negatively our supply chains. They normally work under the Ministry of Health, and the manager sometimes is whether the logistics person or someone from the program side. but it's also this aspect, also making sure that we are talking about a continuous improvement around efficacy, availability, and efficiency, resilience of supply chain. During challenging moments of COVID, the role of these groups have been, of course, impacted, but it has been also very important that they keep their coordination role. By the way, during crisis, it's where you need to remove this aspect of coordination, this aspect of mobilizing different stakeholders, using them efficiently, but also effectively, so that we maintain immunization supply chain operations and services. So as we advance, we will see how these groups have been able to, or are able to coordinate the governance in country level. So these groups have normally 3 roles. One role is leadership, providing visionary or transformational leadership as a core function of immunization supply chain management. 2, coordination. So we do have these groups to really coordinate the immunization supply chain efforts, interventions, investments, but also 3, to provide some technical expertise in terms of immunization supply chain management, making sure that people are coached or are mentored as we go down to the sites where we don't have maybe a lot of skills. It's really this group that is really able to really conduct some capacity building activities, whether it's formative supervision, organizing training, or other aspects of really capacity building, issuing some guidance so that these technical expertise is provided. All the 3 roles for this group are going to ultimately leading to evidence-based recommendations, because when they are meeting, they are analyzing data, the existing data, whether operations or tactical or strategic data, so they can improve immunization supply chain. They also explore innovative opportunities, dissemination of information, lesson learned, and then overcoming any bottleneck that could impede the program progress, whether upstream when it comes to monitor the orders or shipments, even doing the quantification. Sometimes they're also involved in doing some demand planning and forecasting, and cooperated by supply planning, really to make sure that the products are arriving on the right time and in the right quantities and right quality. So these bottlenecks should be really mitigated from the beginning, but also downstream to check if there's any issue on stockouts or products that are near to expire, maybe to decide to make some decisions to really utilize these resources very optimize the way. But also, as I said, human resource and material resources. These groups have been affected by COVID, but they have also been adapted. They adapted themselves to the disruptions caused by COVID. As we all know, COVID-19 pandemic has really caused a lot of strain, a lot of disruptions in the global and national supply chains, knowing that we all talk about here really the global aspect of supply chain, especially that it started in China, whereby most of global procurement are really, global supply chains are really based, like industry, logistics aspects of moving goods and materials. So these disruptions went down to other countries like India, like even our own countries. So if we talk about flight cancellations, trade restrictions, most of the vaccines were normally shipped through commercial flights. So as we get these flight cancellations to control the pandemic, but also the trade restrictions, some countries trying to also to protect their own people, trying also to stop any unnecessary movement. So we had this as a and then the consequence was really that we had some disruptions in our supply chain. So the country groups, national working groups, had really to make sure that they bring some innovation. They're trying also to maintain the continuity of the program. And as you remember, WHO and UNICEF have sent a joint statement to make sure that routine immunization is continuing so that we avoid additional death. So even if some countries decided to modify the immunization sessions, but the concern was really to keep protecting children and other people who are candidates for these vaccines for any outbreak. whether for routine vaccines but also for any planned campaign. So these groups had to really make sure that they are bringing in their value. One, as I use their roles, under program leadership and coordination, they are recommended to continue sustaining program management and coordination throughout this time, especially by developing and implementing a continuity plan so that the operations, supply operations and services are continuing without or with less disruptions, but avoiding also duplications across partners. In a time of crisis, we need to really use our resources very wisely and very efficiently, and trying also to do gradually resumption of operations in a case that they are stopped in middle. The second level of involvement was to maintain an oversight and guidance on the overall immunization supply for routine immunizations and any supplemental immunization activities, to continue protect health supply and logistics workforce using some infection and prevention control measures, like providing or asking or advocating for getting personal protective equipment. We're also asking them or recommending them to provide guidance on how to really use such support, whether part-time or full-time of staff for additional people so that these services continue. They are also requested to update their work plans, advocate at national level to include the immunization supply chain tasks within the essential services, so that even if there's a lockdown, these people can move and go to their post, but also trying to continue using the collaborative working tools to monitor virus work streams, even remotely. They had to organize meetings. They had to really adapt and see how they can continue to monitor the work stream of these activities. The second function on planning, the groups were requested to make sure that they start to plan even during the response time to plan when things are going to resume. How do we make sure that we plan ahead of time? We organize any outreach session if needed, or any vaccine introduction as we were talking about this one. So they had also to revise their plan and update them, but also to see when things are normalized, how they are going to resume their services. The third function on partnerships, the groups were very critical to continue leveraging the existing partnerships, but also joining other efforts to make sure that the response of COVID-19 is already coordinated, but also track and amplifying ongoing support by member organizations represented in this group, and then asking the other partners they had, so that including the private sector, that they are really leveraging the cooperation and bringing this new innovative way of doing. So I'm going to share some experience at country level. We had 2 sessions in August where countries have shared their own experience during the pandemic. So in total, we had 6 countries, but maybe this experience was also be shared by other countries. We had representatives from Democratic Republic of Congo, we had Cameroon, Madagascar, Kenya, Ethiopia, Nigeria, and Afghanistan. And the very first part on coordination, we learned that countries have been able to use more data in country data using digital collaboration platforms, trying to reuse even some online meetings, platforms like Zoom, trying to continue the coordination. Even if people are staying in their home, work should not stop. So we are really very impressed the way countries have been able to adapt and use the digital technologies so that they can continue coordinating among themselves. Number 2, even if it was very hard to train and physically go in supervisions, so countries have brought some innovative way of supporting their staff downward, of course, using remote supportive supervisions, whether through phone calls or WhatsApp groups. So countries have brought some innovation to continue supporting their staff, even for lower level staff. Of course, it was all about behavior change. These groups has been also very critical to also be part of this social mobilization, especially on the use of PPE, because even for people who are working in supply chain could be exposed to to the virus. So they had also to mobilize them to change this behavior and to protect themselves. Of course, lastly, they had to plan and they had to follow up any pending shipment that was coming in or anything that was already there to be distributed, even to be sharing or to be moving products where they are not used to the other places where they are used. And try to also plan ahead of time if there will be any catch-up vaccination in line with the revised annual immunization plan. So these are some experiences that we got from countries, and we hope that they are going to continue even after COVID. And I think other countries could also share, and if you have maybe your own experience, you can even share in this, then we can also cross-fertilize among ourselves and use your best lesson learned to even prepare for COVID-19. Welcome again in this second part of our session. We are going to use this time, the coming 15 minutes, to do a panel discussion. So we have some countries that are going to share their own experience, and I'm honored to have the Rwanda Biomedical Center, the head of unit of vaccination, Suman Hassan. Welcome, Hassan.
Thank you, Patrick.
And I have in Cameroon the head of logistics and maintenance unit within the central technical group of immunization, King Marius. Welcome.
Thank you, Patrick.
Okay, so before we start, I will just give you like 1 or 2 minutes just to introduce yourself to the audience and your role really in the coordination of supply chain, immunization supply chain. Maybe we start by Hassan. Hassan, can you just quickly introduce yourself? Thanks.
Yeah, thank you, Patrick. So my name is Suman Hassan. I'm from Rwanda. I'm the EFA manager for Rwanda. So I have been working in vaccination program since 2012. Now it is almost 10 years. As you know, vaccination program is very large. So one of the operations, it includes also supply chain management of vaccine and vaccine devices. Thank you.
Thanks so much, Hassan. I think you're the right person here to talk about really coordination. And your experience during COVID and after is going to be very critical. Marius, over to you, the introduction of yourself.
Thank you, Patrick. I'm Marius Vokim from Cameroon. I'm the head of the section of logistics and maintenance at the API Central Technical Group in Cameroon. And I work since 4 years in immunization supply chain at the central level, and we work in the coordination of national working group, and we also work to try to ensure that the vaccines are available at the health facility. Also try, when I have time, to write some paper in vaccination and immunization supply chain. Thank you.
Okay, thanks so much, Marius. Thanks so much, Hassan. So one of the main question for everyone here is really COVID-19 experience. I know your countries respectively have continued to do some immunization activities, and we can't do immunization without supplies, without vaccines, without the ancillary products. So I want to really learn from you, what have you really learned from this pandemic, but in a way that it's very positive, in a way that, you know, any crisis could be challenging, but it's also a time of opportunities to learn and to be better of ourselves. Can you share with us, maybe starting by Hassan, can you share with us what COVID-19 has taught you and your program, and how can you continue to build the supply chain to stronger leadership using COVID-19?
Yeah, thank you, Patrick. So really, you are right. You are right with the pandemic context, and especially this COVID pandemic. There was so many issues around supply chain management. But what I can say is that in Rwanda, it seems like we were prepared. So I can say that we had a chance of really having planned very well our shipment for vaccine and vaccine devices. When this pandemic started to spread all over the world, and lockdown started here in Rwanda in March, so we had enough supplies for vaccine and vaccine devices to cover the whole year. And this is because actually we had a very good storage capacity at the central level, because actually at central level now, if you look at the number of children we are targeting on an annual basis, they are almost 360,000 per year as surviving infants to be vaccinated with most of antigens we are using in routine immunization. And if you look at the capacity we have at central level, we have got 10 code rooms, 9 for positive, plus 2, plus 8 degrees Celsius. So these 9 code room of 40 cubic meters for each. And they also have got a freezer room of 20 cubic meter in which we are storing mainly polio vaccine, even though today we are also keeping some Ebola vaccines. So with that capacity, for us, we had the good capacity, the good storage capacity, storage to manage all these vaccines. So for us, I can say that there was no issue, because at Central we were covered with enough capacity to store all these vaccines. But also, if you look at the way we are using to distribute vaccine, so actually, since last year, we started to redesign our supply chain management system, where we have been using pull system, but currently we are mixing pull and push. At central level, we have been able to procure refrigerated truck, and we are using this truck to distribute vaccine in all hospitals. And then health centers, they are coming to collect vaccine from hospitals. So for your information, we have got 3 levels, the central level, intermediate level, which is district, and also health center. So it means between central level and district, there is no problem, because actually we are doing some kind of active distribution to distribute vaccine to all hospitals. And then health centers are coming to collect vaccine on monthly basis from hospitals. So when there was lockdown, so for us it was not really complicated, because actually had been using this truck. So we had the authorization of going out of capital city Kigali to distribute vaccine to all health, to all hospitals. So it helped a lot. And what I can say as this one learned is that every year when you are starting your plan, really you have to make sure that you are organizing very well your shipment plan. If you have the chance of having a good storage capacity, make sure that you don't have at least the supplies for less than 6 months, because actually we have seen that having a good supply, it is the heart of vaccination program. You can not say that you have got a good vaccination program, you are covered without having supply. And one of the supply is vaccine. And remember, having vaccines only, it is not enough. You have to make sure that also your cold chain equipment are working very well, but also your vaccine devices like syringes, because actually you may have some doses, but if you don't have devices like syringes, so it will be a bit hard to make sure that also you can deliver those vaccines. So in summary, this is how we try to manage this COVID pandemic context with vaccination. And for your information, I can say that our coverage in relation for all antigens, it declined a little bit, but it is not as bad as people were thinking that COVID pandemic, we shall lose children to be vaccinated. So if you look at the coverage, so we are almost at 90%. Even though before the COVID pandemic, the coverage was exceeding 93% for all antigens, but at least even during this pandemic, the coverage didn't fall below 90%. So where we had only an issue, it was for HP vaccination program, but it is because actually the strategy we are using to deliver HP vaccine, it is in schools. So at the time we were planning to vaccinate, it is where the lockdown started. And then later on in June, we said to see how we can deliver still this vaccine. And we changed the strategy we had been using. We used now the community-based approach to deliver this vaccine. So in general, for other antigens, there is no big issue, but it's because actually we had a good supply for vaccine and vaccine devices. Thank you.
Yeah, thanks so much. Maybe whoever's not speaking, maybe you could just mute, because it's, I know it's challenging for everyone. It's new normal. Maybe Marius, can you mute yourself so that you can get your voice? Last time. Okay, cool. So Hassan, you've said about the continuity of the program. I know sometimes, but many countries were obliging people, the entire services to be on lockdown. How did you manage the lockdown? You had to deliver it.
Sorry, Patrick, can you come back again? I can't hear very well. The voice is not good.
Yeah, I'm saying that some countries, including Rwanda, I know, have selected, have chosen to, sometimes back when the pandemic was starting, to establish some measures like lockdowns, whereby most of the services were stopped. I could imagine that it could also have affected your program. How did you cope with the lockdown? How the organization supply chain continued with that?
Yeah, thank you, Patrick. So actually, our health services is not only vaccination program. There was no disruption of health services in Rwanda. In all health facilities, health services continued as it was. Of course, there was some issues, but at least all health facilities were still well open during lockdown. And also, vaccination program continued to operate at all level, at central level, at a district, even at a health center level. So at central level, we had this new approach of redesigning our supply chain management, where we used to deliver vaccine to all hospitals, as I have said before, using our refrigerated truck. And also health centers used their motorcycles, it was before, to collect vaccine from hospitals. So on our side, I can say that we were covered because actually there was no issue of supply. If you look at our shipment plan for 2020, so before the end of March, so we had almost received our shipment planned. So if you look at the number of doses we had at that time, so we were ready to cover the whole year for almost all antigens. So that is one of the things, that is one of the factors which really influenced to manage this COVID context. So otherwise, without supply, you cannot manage, because actually, you know, there was no flights at that time. So it was challenging to make sure that everyone had enough supply. But on our side, because actually we were covered with enough supply for vaccine and vaccine devices, so this is why we didn't really have issues with the continuity of services.
Okay, yeah, fantastic. Let's go to Cameroon. Marius, can you share with us some lessons learned during COVID pandemic when we had some disruptions, and how did you manage to go through those? Marius?
Thank you, Patrick. I think we have the same issue with our colleague in Rwanda, but in Cameroon, we to try to manage and try to improve vaccination in our country. The first step in our side at the central level, we increase the frequency of transmission of stock management dashboard. I think SMT, and we also improve the use of Viva in central level in collaboration with our colleague in UNICEF SD. And we try to conduct our meeting on per week, and we also take the measure to have additional fund at the center level to try to get the vaccine at our level, and try to push it in the 10 region. In Cameroon, we have 10 region, and we have 10 logistician in the one per region. So we also try to improve the emergency mechanisms at central, and regional level to try to improve continue vaccination and availability of vaccine in the district. We also try to read at one guideline on continue vaccination in the context of COVID-19 pandemic. And one of the lessons that I can share is we should have ability to continue improvement, to change the way of work, and also flexibility to try to adapt of any situation at the all level of our immunization supply chain.
Okay, yeah, thanks so much. You are talking about adaptation, agility, when trying to be more responsive to the realities, as you are saying. Yeah, if I could now go to very second theme of our discussions, we know that countries are really waiting impatiently on any eventual COVID-19 vaccine, and there are many global discussions around that. Most of the vaccines, I would say, they're still in a very early stage, but some are advancing with some promise maybe coming next year also. How are you getting prepared, Hassan, in Rwanda for any vaccine? I'm sure your program is going to be involved. Did you start to do any planning? Do you see something like horizon, or you're not yet?
Yeah, thank you, Patrick. So I know this is a burning issue of where. So how are you going to manage this new vaccine, COVID-19 vaccine? But really, for me, I'm very comfortable with this COVID-19 vaccine to be introduced, because actually, if you look at the number of doses we are going to receive for COVID-19, so you know that now we are planning to, we are saying that at the beginning, 20% of the total population will be vaccinated. So if you look at the total number of people, the population in Rwanda is almost 13 million today. So meaning that 20%, it would be almost 3 million. So actually you have managed vaccination campaigns having more children than these 3 million. So if you look at the campaign we conducted in 2013, so we vaccinated under 15 children. And if you look at the number, it was almost 5 million. So 5 million, we vaccinated all of them in 1 week. So it means even for this COVID vaccine, we don't have fear, so we can manage. So one of the attention we have to put on this COVID vaccine, it is only the requirement of storing this vaccine, because actually we don't know yet which vaccine will be out first to be used, because you may find that the storage requires like temperature in which we don't have the capacity in the vaccination program. So let us say if it is like a vaccine to be stored at -80, as it is for some vaccine like Ebola vaccine. So it may be difficult because we don't have that capacity. But if this vaccine is being to be stored at normal temperature as other routine vaccine, between +2, +8 degrees Celsius. So for us, there is no problem because actually we can manage. We have conducted this kind of campaign involving so many people. So maybe it is something to be discussed again and assess the capacity we have today and how ready we are. But on my side, I'm very comfortable. I don't have fear of receiving this COVID vaccine, and make sure that we are arranging everything so that it can be given to the targeted population. Thank you.
Yeah, thanks so much for citing experience of the past. Yeah, you were able to vaccinate more people than what you're projecting this time. It's really encouraging. How do you see coordination in that cooperation? Do you think coordination capabilities is already built in Rwanda? I think it's something we are really putting enough efforts, like coordination, leadership. How was very useful when you did in 2013, and how are you going to use coordination capabilities?
So, you know, in Rwanda, we have got a good capacity to manage this kind of campaigns where we can vaccinate so many people. So let me inform you that on an annual basis, we are having what we call MCH Week, Maternal and Child Health Week, 2 times a year, where we are targeting so many children and women, and we are giving so many interventions. Even though we are not always vaccinating, but also we use this opportunity to make sure that we are tracking those children missed before. So on our side, we have got this experience of conducting mass vaccination campaigns, even other campaigns. So what we do is just to make sure that you have got a good team. So you cannot manage these kind of campaigns alone. So you have to involve so many people, so many stakeholders, so that you make sure that everyone knows how to do A, B, C, D, and also you make sure that everything is done at its right time, because actually, if you don't have a good plan, if you don't have people assigned to do activities, in that case, you can be surprised at the end. So the secret here is to make sure that you are prepared before, and you were meeting people so that you can discuss the progress. You can assess your readiness. This is what we are trying to do. Even we have started to see how ready we are. Even on Monday next week, we have got a meeting to assess our readiness for COVID-19, because actually we have got some tools to be completed and shared with WHO and UNICEF. And if we have got a need of support, so this is where how you can see what you need. So otherwise, if you are not prepared, if you don't have a steering committee with some people in charge of monitoring and evaluation, some people in charge of coordination, some people in charge of logistics, some people in charge of finance and other components, so you can be surprised. So to be prepared very well, you have to make sure that you set up a steering committee with so many subcommittees, so that you make sure that each area is covered in this way. Thank you.
Thanks so much. Let's go to Marius. Marius, how are you getting prepared for COVID-19 vaccine that we think is going to come soon, or sooner than later? Marius, are you getting prepared? Do you have something to share? Any past experience in the same kind of operation? Thanks.
Okay, thank you, Patrick. About the COVID vaccine, COVID vaccine, we now in Cameroon, we just waiting the decision of the Ministry of Health, and also the global decision to conduct vaccination with this vaccine. But Cameroon have a lot of experience of vaccination campaign. We also conduct a yellow vaccine campaign. We conduct measles and rubella vaccine, and now we conduct the OPV vaccine app. And we have a strong group, a strong coordinator group in a central and regional level. We have a strong national working group at central level. Now we try to create the same way in the regional level, the regional logistic working group, to try to coordinate all the aspects of immunization supply chain in the region and in the FD6. So now, if the decision has been taken to vaccinate in, I think next year, for example, we could able to conduct easily this campaign, and to try to use the same sheet like forecasting tool to have the real quantity of vaccine to the population.
Okay.
Thank you.
What I'm learning from both of you guys, you've got experience, you have teams, you are ready. I wish you all the best in these preparations. Maybe any final word, Marius? Anything you could maybe to conclude? What could be like critical? Like if I just say, give me like 2 words that you really think they are very critical to take into consideration when we get vaccine in the country. Like 2 words, like what is critical? What is really essential not to forget?
2 things for me. Availability of fund, and the second thing is the a good readiness assessment in the national level.
Okay, Hassan, to conclude, just two ingredients you could really advise other countries to be considering when they are getting ready.
Yeah, thank you, Patrick. So what I can say as something really everyone have to remember is that when there is especially a vaccination campaign, you can't say that I'm 100% prepared. So you have to make sure that every day you are assessing yourself. With the COVID-19 vaccine, so we can be surprised. So when there is a campaign, please make sure that you're working as a team. No one can handle these issues alone. And also make sure that you are prepared before, not at the last minute. This is what I can add. Otherwise, I can also give a word of thanks to all partners, especially UNICEF during this COVID. So you have been very cooperative. This is very important because actually when you have got an issue and you have someone to talk to, so this is also important. It is somehow motivating. Thank you a lot.
Okay, thank you, Hassan. Thank you, Marius. I know it has been very hard to get some time for this, but I know you are very flexible, and I really appreciate your inputs. And we keep learning from you, from your experience. Thank you so much.
Thank you, Patrick.
Okay, bye.
Hello, everyone. I'm Adebayo Adekola, and that was a very interesting session on immunization supply chain leadership and governance. And as Patrick and Marius and Azan were talking, many words, came to mind. And I would say the first is actually planning accordingly for, the immunization supply chain in countries, and also the role in which planning has actually, played in ensuring that there is availability of vaccines and countries can resume campaigns, and also, in preparation for the new vaccine. So right now is question and answer sessions. I don't know if there's anyone here with questions, so that we can take some of the questions around leadership and coordination of the immunization supply chain. If you don't have questions, you can also give comments also. So please feel free to share some of your comments. I noted some of the comments from a number of us around, is the vaccine for COVID-19 going to be universal, or Africa is going to have a different type? I'm sure that with regards to this question, the vaccines will be the same, obviously, and definitely, we won't. There will be no issues of it being different. We know that it's one vaccine, so it would definitely focus on having the same vaccines across the various countries. But also, of course, in relation to the issues of quality, that's something that also is being taken into consideration as we think about the new vaccines. There are some questions here that I would definitely, address to the individuals, because some are around regulation and coordination in specific countries. But I also want to acknowledge Lucy for providing a comment on what they've been doing in Kenya, on how they've been able to navigate issues of closures during the COVID-19 situation, and especially when the health worker tests positive to COVID. What do they do, and what, in terms of self-quarantine, and how do they resume back? And that's really a good practice. To share that, basically, she said they calculated the vaccine needs for 1 month, reported to the warehouse, and did an emergency order within the system. So of course they were able to navigate that system accordingly. So please feel free. You can also type your questions. You can also feel free to unmute and share your thoughts, your comments, your questions. We would like to hear from you. If there's none, I'm going to definitely ask you some questions. Is there anyone who wants to share their thoughts, ideas, questions with us? We have just 5 minutes, so anyone with questions, please do feel free to share with us.
Okay, my name is Timmy. Thank you for the presentation.
Great.
I just want to ask, from the experience so far, what role did the Rwanda government at any point use a new technology, and what role did the government play in adopting such technologies and innovation?
Thank you so much, Timmy, for that question. And no better person to answer that than Patrick Aparai, who also happens to be from Rwanda. So Patrick, any thoughts around that question?
Yeah, thanks so much. By the way, I'm live now. The other time I was recorded, and that was when my first time to be recorded. Anyway, I'm even currently in Rwanda. So the answer for vaccine will be no. I mean, it's not yet used for, they don't use drones for this. Maybe it's in the project, but they didn't use drones for this, but they use for other stuff. Thanks.
Thank you so much. I know that Rwanda has really been doing a lot of, using technology for testing, and even the washing of hands. It's also something that Rwanda has also taken into consideration. But for now, there is no drones carrying vaccines, in the country. Thanks a lot, Patrick, for that. Any other questions? Any other contributions from the audience?
Yes,
and I see. Oh, who is that, please? Feel free. Hello.
Elijah, this is Elijah.
Okay, please go ahead with your question.
Yes, it's a comment. I just want maybe it can be put in place by some of the countries, because in most cases you find that vaccine is okay, and then the children who receive the vaccine, for them they don't know anything. But what we need to do is maybe to have a department, for example, of communication, to teach the parents to be sensitized far ahead before the program begins, so that they are aware, so that there's no myth about the vaccine, so that this program can be able to reach every place deep in those places that are not be able to be reached.
Okay.
That's my comment.
Thank you so much for that comment. You're stressing on not just the supply side, but also the demand, aspects for the vaccine. And I think the behavioral change communication, BCC, will be quite important in driving the demand for the vaccines. Of course, also addressing issues of misinformation with the vaccines, and what the vaccine is supposed to do. I think that's something that countries also have to put into consideration. And it's also a job for the supply people, not just only those within the program itself. Thank you so much for that comment. Do we have any other questions, ideas, comments, best practices from countries? Please do feel free to mute your microphone and speak if there's none. Okay, so I will use a few minutes left to just summarize what we've have really learned today around what countries are doing. As I've said earlier on, one of the main key messages is around planning, effective planning, and we can see that is really happening around with many of the countries that we've spoken with, Rwanda, Cameroon, and many of the countries represented on this in this session. Planning is a key component, but also important is being able to coordinate through the logistics working group or available coordination mechanisms in the country. So that is something that also we need to pay attention to, because it really helps. I also, I've noted a lot of comments from Lucy around the health workforce, making sure that, they are kept, safe, and also supportive supervision and continuous engagement of stakeholders. Now, which better platform can you really engage stakeholders on a continuous basis? And that is the logistics working group. The session, this is not, you can also feel free to reach out to Patrick Gaparai, and also to the various teams around any further questions you might have around this, how you can strengthen your national logistics working group or an equivalent in the country. So I just want to say thank you to everyone, within the session. We had close to 141 people, which is impressive. And a big thank you to all of the, to the speaker, Patrick, to Asan, and also to Marius. Thank you so much. A big thank you to everyone for joining. Okay, thank you.
Thank you so much, Bayo. Good moderator. Thanks, bye.